Some of the things that we do to help set people up for success that we have in the office that are unique to this office as far as I'm aware of is that utilize very specific protocols. We want to look at nutrition. We want to take a look at how they metabolize their food. We do a metabolic breath analysis, and it gives us ideas as to what works for them, what doesn't work for them. It also provides nutritional data, nutritional recommendations, and can go as far as exercise recommendations as well to lead them into a healthier place. Part of that protocol is we do supplementation. We're looking at certain things like vitamin D3, we're looking at magnesium, we're looking at calcium, we're looking at different things, and in these supplements that we have and that we recommend, they are specifically developed for bone and soft tissue healing. And so we want to prepare the body for the procedure and for the healing that's required post-operatively. And what we like to do with the patients leading up to this is we want to get them healthier. So we do put them in a hyperbaric oxygen chamber, but it's a very pleasant experience. It's very easy. There's no discomfort whatsoever. That's one of the things we do because we're flooding the body with 95% oxygen as opposed to the atmospheric oxygen levels. And we're oxygenating the red blood cells, and we're doing everything we can to get the patient into a healthier position. Some of the other things that we have high intensity PEMF therapy, which helps with everything from mitochondrial function and metabolism and ATP production, and helps people feel better, helps people feel more energetic, also helps with wound healing. Pre and post-operatively, it's another really good option. And we have red light therapy as well. And that's another thing that we use post-operatively to reduce pain, to reduce inflammation, reduce swelling, or to prevent those things from happening in the first place. Another thing that we have that's super exciting is the HOCAT. And HOCAT stands for hyperthermic ozone carbonic acid transdermal therapy. And it's a machine that you sit in and your head sticks up out of it. And what it does, the chamber warms up and it releases some CO2, and then that helps open your pores. It's a vasodilator, and the ozone floods the chamber. There's also infrared light therapy that's going on inside the unit at the same time. And there's also different frequencies that we can set with that. One thing that I think is important to say is all of these things are on a case-by-case basis, and we evaluate the patient, the health of the patient, and the circumstances that we're dealing with. So if this sounds like a lot, and as a patient you're going, hey, I just want to go in there and get my tooth pulled or just get an implant, not all of these things are always a requirement for everything that we do, but depending on the circumstances, these are things that we offer to help enhance our chances of good success and predictability. So I don't want all of those things to sound intimidating. I want those things to sound exciting for someone that may be concerned about going through something and wondering if it's going to work or not. We do everything we can to make it as predictable as possible, and we customize each plan to fit the patient accordingly.